Hello, Dr. Powers. This is my presentation of music therapy to schizophrenic patients stakeholders education plan. The presentation will start with the project title, followed by the stakeholders, then the stakeholders' educational need, stakeholders' roles, theoretical framework, delivering education to stakeholders, mental health facility benefits, and project feedbacks. The title of my project is Among Patients aged 21 to 50 years old with schizophrenia, does listening to self-chosen music for 30 minutes a day as adjunct treatment compared to treatment with no music therapy affect in improving patients' quality of life within 60 days. The stakeholders for my study are the study participants, providers, and facility administrators. Stakeholders include those individuals, groups, or organizations which either affect or are affected by the actions taken when conducting a music therapy project for people with schizophrenia. The major stakeholders consist of the patients, which include the people diagnosed with schizophrenia who will be the participants in the project. The people selected for the study must give informed written consent and have a co-signer they rightfully know and trust to sign as a witness. The providers. In this case, the providers will include a team consisting of a psychiatrist and two nurses, including me, who have experience working with people who have schizophrenia, and also a highly qualified skilled music therapist with a master's degree who specializes in psychopathology will participate in the project. The facility administrators, healthcare administrators, and managers on a daily basis are systematically assessing the complex dynamics that influence the ability of healthcare providers to practice in different healthcare settings. They are also developing policies and procedures to direct safe healthcare practices and providing education to staff regarding the interpretation and implementation of these policies and procedures. The availability of staff development department is a critical factor in assisting the staff to use these policies and procedures in delivering safe and competent care. Healthcare administrators and managers can also increase patient safety by fostering an environment in which the staff are in control of their own healthcare practice. Stakeholders' educational need. This music therapy project is based on meta studies which have previously confirmed such benefits in their evidence based practices and research findings. Therefore, all major stakeholders need to understand the significance of music therapy in the quality of life of individuals diagnosed with schizophrenia. This is ultimately achieved by understanding the importance and benefits associated with utilizing a music therapy for participants with schizophrenia. The project is geared towards ameliorating some of the symptoms associated with schizophrenia, as well as increasing their ability to actively partake in a social setting. Musical activity diminishes negative symptoms and improves interpersonal contact. These positive effects of music therapy could increase the patient's abilities to adapt to the social environment in the community after discharge from the hospital. All stakeholders must know that schizophrenia is categorized as a severe and enduring mental illness, or SEMI. People living with schizophrenia often live in isolation due to their inability to secure regular employment, as well as inability to develop and maintain relationships with their family and friends. Based on a recent research study of adults living with SEMI, studies reveal that approximately 58% were socially withdrawn. Of those who were socially withdrawn, 39% reported not having a close friend, and 45% wished they had people they could call friends. Since social isolation inhibits clinical recovery for people living with schizophrenia, the Music Therapy Project will focus on individual music therapy sessions by listening to music to reduce the reported symptoms associated with schizophrenia. Stakeholders' roles. The participants. These are the patients diagnosed with schizophrenia who will actively engage in a 60 days music therapy project. 30-minute session, which is listening to self chosen music using headphones. The psychiatrist, a nurse, and myself will evaluate the symptoms participants report at the beginning and at the end of the project. The music therapist will lead all the participants involved in the project to identify the kind of music they like and listen to it for 30 minutes using headphones. The music therapist has a crucial role in this project. A highly qualified music therapist with a master's degree will lead all the participants involved in the individual and group sessions during the music therapy implementation. The facility administrators who will implement policies to increase the use of music therapy to schizophrenic patients. The first session will be allocated to first, introducing the project to the people with schizophrenia which will participate in the music therapy project after signing a consent form co-signed by a witness. Second, there will be a completion of a baseline questionnaire with supportive encouragement as people with schizophrenia tend to be easily distracted. Lastly, discussion with a music therapist. Theoretical framework. The theoretical foundation underlying the education of stakeholders is based on education and clinical training in music therapy using the action, relationship, communication method, or the ARC. Music therapy is a composition of a music based foundation and a clinical based foundation. Music therapy focuses on the principles, methods, and techniques used to assess and evaluate the psychology of music and its influence on behavior with various populations, especially patients with mental health problems. The music therapy professional involved in the study have a music foundation comprised of the significance of applied music, conducting, composition, and arranging, music history and literature, music theory, and improvisation, in addition to a clinical foundation focused on psychopathology, normal human development, and the therapeutic relationship influenced by music therapy. The framework for the music therapy project based on the Action Relationship Communication Method, or the ARC, is a non directive method based on the premise of making music by being intrinsically interactive with each schizophrenic patient and the music therapist. The goal of the ARC method is to create other ways schizophrenic patients can become socially integrated through musical activities. Since stakeholder groups will be involved in various levels of the music therapy project, they must be educated about the method utilized in the project. The experience of choice becomes important because it expresses and defines an identity, which is a component that people with schizophrenia often lack. Delivering education to stakeholders. The plan to deliver education to stakeholders will be in this order. First, facility administrators. Second, psychiatrist and nurse. Third, music therapist. Fourth, study participants. I will schedule a meeting with each stakeholders and present to each of them my project and its importance to schizophrenia patients. This includes previous research studies about music therapy and schizophrenia and the current statistics. My presentation during the meeting will also include stakeholders' educational need, stakeholders' roles, potential mental health facility benefits, and project feedbacks. The first meeting will be with the facility administrators. They manage, supervise, and is in general administrative charge of a facility. They ensure that the mental health facility is in compliance with all applicable requirements of federal regulations. They oversee and direct the persons employed by the mental health facility as necessary to ensure that the residents or clients receive needed services and protective supervision. The second meeting will be with the psychiatrist and a nurse. The psychiatrist and the nurse will help me evaluate the symptoms participants report at the beginning and at the end of the project. I like to inform the psychiatrist that his or her patients will be a participant of my project. The third meeting will be the music therapist. He will lead all the participants involved in the project to identify the kind of music they like and listen to it for 30 minutes using headphones. The music therapist will supervise the implementation of music therapy, making sure that it is done appropriately. The fourth meeting will be with the study participants. They will actively engage in a 60 days music therapy project, a 30-minute session per day, which is listening to self chosen music using headphones. I will need study participants to give informed written consent and have a co-signer they rightfully know and trust to sign as a witness. They are the most important part of my project because they will determine the success or failure of my project. Their response and result after the implementation of music therapy will be recorded and analyzed. Mental health facility benefits. Analysis of the music therapy project compared with the usual standard care will demonstrate improvement in the mental state as well as social functioning of people diagnosed with schizophrenia. Individuals involved in the project will display increased self esteem, which enabled them to cope with anger, mood, decreased anxiety, and other symptoms associated with schizophrenia. Once people with schizophrenia are able to decrease their level of social anxiety, they could begin to develop strong, positive, long lasting relationships with family members and friends. Family and friends will serve a dual purpose as they will become an integral part of their treatment as their support system. Patients diagnosed with schizophrenia often experience qualitative benefits as they begin to explore their personal feelings in a positive manner through music therapy. The music therapy project will bring an immense amount of joy and jubilation to participants with schizophrenia. The project allows individuals to use creative self expression to produce a positive outcome. Creating a relaxing ambience in a safe environment helps schizophrenic patients to actively engage in a group social setting. Participants will feel a sense of utter accomplishments as they continue to listen to their music of choice, which could be shared with family and friends. In addition, working together as a group increases social interaction, thereby minimizing social anxiety, mood swings, psychosomatic symptoms, and fighting prevalent in mental health facilities. There will also be a decrease of disruptive behaviors and improves mood, therefore requiring less staff or at least reduced staff interventions. Project feedbacks. The interview will focus on what it's like to be part of the music therapy program, how the project could be improved, and whether they would recommend this project to other people diagnosed with schizophrenia. Stakeholders will get feedback from the development of the project as psychotic symptoms associated with schizophrenia will be tested at the beginning and the end of the project using World Health Organization Quality of Life (BREF) questionnaire, the Social Interaction Anxiety Scale (SIAS), and a Brief Symptom Inventory (the BSI). WHO Quality of Life (BREF) has been psychometrically evaluated as a comparable instrument aimed toward a quality of life assessment used worldwide. It is comprised of 16 items which measure the environment, physical health, psychological health, social relationships of individuals involved in this project. SIAS is a 20-item questionnaire about being with other people in a social setting. Higher scores on the social anxiety scale indicate more social anxiety. Lastly, the BSI is a 53-item self-reported scale that detects several clusters of psychiatric symptoms and has been recognized for both validity and reliability. The qualitative data collected from these questionnaires and t-tests will run for all items on the questionnaire, and statistical results will be gathered and recorded accordingly so that feedback will be in the form of both qualitative and quantitative data. This concludes my presentation. Thank you so much for the time, and I am open for questions, suggestion, and comments. Thank you and have a great day.